নমস্কার, দেখছেন কলকাতা টিভি, সঙ্গে রয়েছে আমি স্বর্ণালী। শুরু করছি আমাদের বিশেষ অনুষ্ঠান ডাক্তার বলছেন। আর ডাক্তার বলছেনে আমাদের আজকের যে বিষয়, গত মাসে আমরা দেখেছি পার্কিনসন্স মান্থ গিয়েছে এবং সেই পার্কিনসন্স রোগ আসলেই কি সে সম্পর্কেই কিন্তু আমরা আজকের এই ডাক্তার বলছেন আলোচনা করব। এই মুহূর্তে আমাদের সঙ্গে স্টুডিওতে রয়েছেন ডক্টর বিজয় শঙ্কর, সিনিয়র কনসালটেন্ট নিউরোলজিস্ট অ্যান্ড মুভমেন্ট ডিসঅর্ডার স্পেশালিস্ট। আপনাকে স্বাগত জানাই ডক্টর বিজয় শঙ্কর। ওয়েলকাম টু হিয়ার। ডক্টর বিজয় শঙ্কর, I glad to ask my first question that actually what is Parkinson's disease?
Parkinson's disease is a disease of elderly. Like people when they become old, people will develop this Parkinson's disease. Like this is due to there is a chemical in the brain which is called as a dopamine. This dopamine, when the chemical secretion is reduced, automatically many patients will develop features of Parkinson's disease.
And Dr. Vijay Shankar, how does this affect to the brain and body?
We divide the Parkinson's disease symptoms into two different types. One is motor symptoms, like many patients will have the shaking of the hands, like kapta hai. Then they will become slow in their day-to-day activities like brushing, dressing, walking, everything will become slow. And sometimes they can have like a stiffness of hands and legs and difficulty in walking. Sometimes many times the patient will have a falls, and many patients will have a like a mask like faces, like the face will become expressionless, and while walking they will have the arm movements will be reduced. This is called as a motor symptoms.
একেবারে, অর্থাৎ ডক্টর বিজয় শঙ্কর, আমরা কিন্তু দেখতে পাই যে বিভিন্ন ধরনের যে সাইন্স বা সিমটমস সেখানে কিন্তু এই পার্কিনসন্স রোগের সঙ্গে যেগুলো জড়িত, আমি জিজ্ঞেস করতে চাইবো আপনাকে অ্যাকচুয়ালি হোয়াট আর দ্য আর্লি সাইন্স ফর দিস ডিজিজ দ্যাট পিপল শুড নট ইগনোর?
The cardinal symptoms, as I told you earlier, what we call it as a tremors, T for tremors, R for rigidity, or A for bradykinesia, slowness, or postural instability, falls. But this is the first few symptoms which you notice, but more soft, subtle signs are there. As I told you, there is a mask-like faces can be there, or sometimes loss of smell can be the earlier symptom, memory loss, sometimes mood swings, especially the anxiety can be there, or many patients, they can, during the sleep, they will be talking or acting out their dreams, or sometimes the constipation may be a earlier symptoms which can occur at least 3 to 5 years before the onset of Parkinson's disease. Slowly in the patients, slowly they will develop to see these motor symptoms, but these non-motor symptoms can occur at least 3 to 5 years before the onset of motor symptoms.
Is this only for showing in the elderly peoples?
This is a very good interesting question. See, most of the Parkinson's disease occurs in elderly. Sometimes we call it as a disease of the elderly. One of the most common neurological disease of the elderly. Usually we see it around like above 60 to 80 years, something like that. But in India, from all over the world, the information, we see more young onset Parkinson's disease. Those patients who develop the Parkinson's disease from around some 30 to 50 years. This is mostly like the difference is like young onset Parkinson's disease progresses little slower than the adult onset Parkinson's disease, like late onset Parkinson's disease. And also this young onset Parkinson's disease, the sensitivity to the medication, the levodopa is more. They will have lots of dyskinesias, and even with minimal medications they can respond very well.
Exactly. And when actually the younger people can understand that this disease or this symptoms is for the disease Parkinson's?
Yeah, the important thing is many people when they are having this Parkinson's disease, they will ignore, because everybody thinks that this Parkinson's disease is elderly, so they will say that no, I don't have Parkinson's. But elderly people, when they have tremors, they will try to come earlier. But younger people tend to ignore these tremors and they will come very late. Even though if you say that you have Parkinson's, the acceptance is very less in younger people, and they also worry about lots of why at this age I develop this Parkinson's disease, and they get lots of anxiety, lots of social phobia they have. But the important thing is, what I would suggest is, this is a disease, like just like another disease, like a diabetes, hypertension, like a heart problems. Any person can develop this Parkinson's disease. Accept the disease, and if you do a good regular exercise and good healthy diet, you can control the disease very well. That's very, very important.
But Dr. Vijay Shankar, that you said what the symptoms are for this Parkinson's disease. So we can see that not all symptoms are just for this disease. Maybe they have feel any other disease too.
Yeah. See, the causes like Parkinson's. Usually, Parkinson's is a spontaneous, idiopathic. There is no specific triggers. But there are other triggers also can be there, like a patient with stroke can present with Parkinson's, or a patient with head injuries can present with Parkinson's, toxins or sometimes even medications can produce Parkinson's. There are several reasons which can produce secondary Parkinson's. So the important thing is, our duty is to find out whether it is a spontaneous idiopathic Parkinson's disease or is it due to some other secondary causes. If it is going to be a secondary causes, we need to address the cause. If you address the cause, the symptoms will become better.
Dr. Vijay Shankar, is this Parkinson's disease is genetic?
That's important. As I told you earlier, we divide it into two different types of Parkinson's. The younger onset is more commonly associated with genetic diseases. Like we have some like 10 years back, we thought all the Parkinson's are same 10-15 years back. Now with the evaluation of the genetic diseases, we are into a precision medicine. Like at least 10 to 20% of the Parkinson's disease at younger onset is due to genetic disease. And we are going further nowadays. We are trying to identify what is the gene which is producing the Parkinson's disease. If it is going to be a LRRK2 or if it is going to be a GBA mutation, we tend to find out these specific treatments are available. If you tend to treat these patients and they respond very well and the disease progression is slower when compared to the other patients. And also with the genetics itself, now we can identify how the progression is going to be for that patient and how precisely what type of medication or what type of treatment we can offer to the patient, how the response will be. So we are more meticulously we are planning, and with the genetics itself, next 10 years, 15 years, how the patient will be there. Now itself we can tell them.
But actually what are the common type in nowadays?
We have at least 4 or 5 types of Parkinson's. One is, as I told you earlier, the commonest which we see is a idiopathic Parkinson's disease, and we have other types also, like patients with like a progressive supranuclear palsy. In these patients, subtype of Parkinson's, the patient will have eye movement restrictions. Sometimes speech problems will be there. They frequently fall backwards. The other type is multiple system atrophy. In these patients, they will have imbalance in walking. Sometimes speech will be very soft, and they have urinary problems. They cannot control the urine. Frequently, they can go to the washroom. All these things can there. The other type is a corticobasal syndrome. The corticobasal syndrome means only one side of the body is affected. Sometimes they can have dystonia, and sometimes abnormal movements of the hands can be there. And the last type is mainly dementia of Lewy bodies. When the disease onset itself, they can have memory loss and they can have a hallucination. Delusions are very, very common in this subtype.
That means dementia and Parkinson's are equivalent.
There are many causes for the dementia. The common thing is Alzheimer's. We have Alzheimer's is one of the most common cause of dementia, but subsequently we see more commonly the dementia, Parkinson's disease dementia or dementia of Lewy bodies are one of the commonest causes of Parkinson's disease. Sometimes we see like strokes, or sometimes we see with like a drug-induced autoimmune infection. There are many causes for dementia, but the most common cause of dementia is Alzheimer's and Parkinson's.
Okay, so is the Parkinson's disease related with lifestyle, Dr. Vijay Shankar?
That's very, very important. What you asked is one of the important questions everybody should know. See, the important thing is Parkinson's disease doesn't have a cure. We can only control the disease progression. The important thing is the healthy diet is very, very important, which we call it as a Mediterranean diet. Like people who take more vegetables, more fruits, and the millets, and sometimes with olive oil and small like almonds, groundnuts, and also they can take fish and prawn weekly at least 2 or 3 times a week, and they have to reduce chicken, mutton and sweets. and they should take more water, at least 2 to 2.5 liters of water, depending upon whether it's a summer or winter. We can reduce it. So important thing is, if they can take this type of healthy Mediterranean diet with a regular exercise, at least 40 minutes per day for at least 5 days a week, we can cut down the disease progression, or other words, we can slow down the disease progression when compared to the others.
And the meditation or yoga, is this good for this disease?
This is very, very important because every patient with Parkinson's disease will have lots of anxiety, stress.
Exactly.
Whenever they get stressed, normally the tremors will be very, very mild. Whenever they are thinking, whenever they get stressed, the tremors will increase. So for that, the anxiety will be there for 5 to 10 minutes. For that, we should not, there is no need to increase the medication. So if I have to control that one, I have to double the tablets, and these tablets has to be taken lifelong. So unnecessarily, I need to treat or over-treat the patient. So instead of that, if the patient does regular yoga and meditation, their mind will be getting relaxed. So automatically this like breathing exercises, all these things, relaxing techniques will really help them to reduce the tremors and anxiety. This is the tremor and anxiety, especially in young patients, especially in older patients, are very, very common, and it's difficult to treat.
একেবারে, অর্থাৎ বোঝাই যাচ্ছে যে লাইফস্টাইল মেনটেন এবং ডায়েট মেনটেন, অবশ্যই খাওয়া দাওয়ার ক্ষেত্রে আপনাদের যে খাদ্যাভ্যাস রয়েছে সেই খাদ্যাভ্যাসে কোথাও একটা নিয়ন্ত্রণ থাকা প্রয়োজন, এবং অবশ্যই তার পাশাপাশি যেমনটা ডক্টর বিজয় শঙ্কর বলছিলেন যে এক্সারসাইজও প্রয়োজন, ইয়োগাও প্রয়োজন। ডক্টর বিজয় শঙ্কর, সো দ্যাট হাউ আ নিউরোলজিস্ট ক্যান ডায়াগনোজ দিস ডিজিজ?
So most of the Parkinson's disease will be diagnosed clinically. When we examine, we know that like the patient is having tremors, stiffness, slowness, everything will diagnose. But sometimes there are many tremors, like a drug-induced tremors, or the tremors which is called as essential tremors. Sometimes when the disease is very early, it is difficult for us to differentiate. Both can look similarly. So in those cases, we do a scan called PRO-DAT scan. This assesses the brain dopamine levels, and it will help us to find out whether it's a Parkinson's disease or some other Parkinson's. Sometimes we ask the patient to do a MRI scan, because this can help us to rule out a secondary Parkinson's or a disease called normal pressure hydrocephalus, stroke, infections, all these things. This MRI will help us to rule out. This is very, very important. If the patients are young, we always ask them to do a genetic study to find out what is the gene, and it helps us to predict the prognosis as well as guide the treatment.
And Dr. Vijay Shankar, what are the actually common causes for this disease?
As I told you earlier, the common causes are almost most of the Parkinson's disease is spontaneous. There is no secondary causes. A protein called as alpha-synuclein, which starts from the gut and slowly it ascends over the 5 to 10 years before the onset of Parkinson's disease, and spreads to the basal ganglia, the area called substantia nigra, and it reduces the dopamine. That's spontaneous.
And actually, what are the common treatment options you have?
If a patient is early onset, like when the patient is very mild, we always prefer to give medications, whichever is required. Like when the patient is having mild problems, we tend to give minimal medications, and we push them to more with the Mediterranean diet and exercises. Over the 3 to 4 years, the disease slowly progresses. When they progresses, at the time we tend to increase the medication to control their symptoms. If the disease is more, when the patient requires multiple tablets per day, at that time we prefer to offer the treatment called as a deep brain stimulation. Deep brain stimulation means there is a small surgery, like similar to a cardiac pacemaker. It's called as a brain pacemaker. We place 2 small electrodes inside the brain, and we place a battery in the chest. This deep brain stimulation controls the tremors, stiffness of hands and legs, slowness in their day-to-day activities. Walking will improve. The medications, they can reduce up to 40 to 70%. And also, many patients, when they take medications, they have lots of abnormal movements, which is called as a dyskinesias. All these things will be controlled, and this is one of the best treatment options available for people with Parkinson's disease. If the patient is not a candidate for DBS, we offer them apomorphine injections, like whenever they are going for a meeting or whenever they are going for a wedding. Suddenly, if the tablet is not working, they cannot move, they cannot work. In those patients, apomorphine injection or small injections are just like an insulin injection, just a small shot. Within 5 minutes it starts its action, and it works for 1 hour, which is called as a rescue treatment. There is other option we have is a apomorphine infusion, like from morning like 7 o'clock, 8 o'clock to night 7 o'clock, 8 o'clock. Throughout the day we put a apomorphine infusion continuously to improve the quality of life. All these treatment options is available in India.
And Dr. Vijay Shankar, after these treatments or this surgery, is that curable?
This
Fully curable?
This is one of the best questions I would like to, I wanted to answer, because all my patients, the first question they used to ask is
it curable or not?
Is it curable or not?
Exactly.
That's the important question. Unfortunately, this is a degenerative disease. We cannot cure the Parkinson's disease. But what I would like to stress is we can control the disease very well. The disease is going to progress, but how it's going to progress, we can manage it. If you do good exercise, if you take care of like a healthy lifestyle, take off the regular exercises, and if you keep yourself happy, the disease progression we can control very well.
Actually, what lifestyles can prevent this disease?
Exercise, healthy diet, less stress, yoga, meditation.
How much important the stress management?
That's very, very important. See, the stress plays the biggest role in the patients with Parkinson's daily life. They tend to get, whenever the tablet is working, they'll be really happy. But when the tablet is not working, immediately they get more anxious. They have lots of abnormal, they feel panicky, they feel difficult to breathe, they cannot walk. They tend to anxious, very, very anxious. But if they do regular exercise, yoga, meditation, obviously we can control this stress and they can have a good quality of life, because every 2-3 hours or every 4 hours the tablet is not going to work. Half an hour to 1 hour when the tablet is not working, they have lots of stress. If you do a regular yoga and like a breathing exercise, relaxing techniques, this can be easily controlled and they can have a good quality of life.
Actually, Dr. Vijay Shankar, you have told about the surgeries or the treatments. So what are the response of patients?
This is very important, patients should know. When I tell them there is options like surgery, immediately they'll get worried. Sir, do I require a surgery at this age? Or like this is a common question for young patients. In the elderly patient, sir, will I tolerate this surgery? What is the risk of life? See, there is only 2% risk for infection, 2% risk for bleeding, or like this can happen with any common surgeries. If you have abdominal surgery or hand surgeries, these are common for every normal surgeries, and we are not going to open the brain. We are going to do like a keyhole surgery, small surgery. Within 4 days we'll discharge you, and this surgery will have a very good improvement in your quality of life. Within a month you can have almost back to normal to life, and also the quality of life, you will see that at least 4 to 5 years back how you are, and we can go to that level. And also the DBS, when the disease is going to progress, and when the disease is going to progress, we can adjust the stimulation and increase the requirement, the energy requirement. Obviously we can control the disease very well. So the success rate is very, very good. Almost I will say like more than 90%, 90 to 95% the patient will have a good quality of life.
And Dr. Vijay Shankar, how does this DBS process working?
DBS, we place like two small electrodes in the brain. We always take the patient when the patient has almost 4 years after the disease diagnosis. When the disease is diagnosed after 4 years, within 4 months of the complication, they can have some tablets not working. When they take the tablets, they will have lots of abnormal movements. In that patients, we offer the deep brain stimulation surgery. It is better to do the surgery earlier rather than late. If you do the surgery earlier, anyhow they require a surgery at some point of time. But if you do the surgery earlier, they can have a good quality of life for a longer period. Another thing is, 2/3 of the surgery the patient will be awake. They can, when you are doing the examination, the patient will be awake. We ask them to do the tapping, finger tapping, hand movements. We ask them to speak. All these things we will assess during the surgery. And 1/3 when you are placing the like batteries, we'll ask them, we'll do a general anesthesia. So within 4 to 5 hours we'll finish the surgery, and within 4 days we'll discharge the patient, and after the programming in a month time they can have a good quality of life.
And this in this treatment process, should the patient have the opinions they have, maybe response, or actually you can share your experience?
The important thing is we do the surgery very commonly. We are one of the we do one of the highest number of surgeries in South India. The patients, especially when you do the surgery very yearly, they can have a good quality of life. I have many patients like they cannot walk, they have frequent falls, or they cannot do their day-to-day work, brushing, dressing, everything. They require support when the tablet is not working. So important thing is when they do the surgery, they can live a life without anybody's support. The tremors will be reduced, and they can do all their day-to-day work without any support, and people will tend to go to work without like they can perform really nicely. And I have a patient who has a Parkinson's disease, like 32 years. He is a gentleman, almost 10 years he has got a Parkinson's. He took tablets almost every 1 hour he used to take, because the problem is very severe. Without the tablet he cannot live. Sometimes the tablet may not work also. Sometimes he requires 2 tablets also. Sometimes he used to take. And if he takes a tablet, he will have lots of abnormal, the dyskinetic movements they have. So almost 5-6 years he cannot go for any work. So we have done the surgery, and now he has, like, he used to take almost 15-16 tablets per day. Now he has stopped almost all the tablets. Occasionally, like half a tablet 3 times a day he was taking. So he went to another doctor, and he asked him, he didn't inform that he has got a surgery, and he told that, sir, I have Parkinson's disease, and he was surprised. At this age, have you got a Parkinson's? And you have very mild disease. And he came to us and told me, sir, everybody told that I have a very mild disease and I don't have any problem. I'm doing really well. And I told them, he showed all these videos to them, like earlier how he was. He cannot work without any support. Now he is doing all his work without any support, and he's back to work, and he's earning a lot, and he's taking care of the family, and his life he has got a life back to normal. That is important. So he is the breadwinner for the family, and now he is able to do the work very well, and he's got the like a family life and the personal life really nice. That's what we can offer.
একেবারে, অর্থাৎ বোঝাই যাচ্ছে আমাদের দর্শকরা নিশ্চয়ই বুঝতেই পারছেন যে কি কি কারণে মূলত পার্কিনসন্স ডিজিজ হয় এবং কিভাবে আপনারা এইটাকে প্রিভেন্ট করবেন, এবং তার পাশাপাশি কখন আপনাদের নিউরোলজিস্টের কাছে যেতে হবে সেটাও কিন্তু যথেষ্ট গুরুত্বপূর্ণ। অবশ্যই ঠিক এই প্রেক্ষাপটেই আমি আরও একটা প্রশ্ন জিজ্ঞেস করতে চাইবো ডক্টর বিজয় শঙ্করকে। ডক্টর বিজয় শঙ্কর, আফটার দিস ট্রিটমেন্ট ক্যান দ্য পেশেন্টস রিটার্ন টু দেয়ার নর্মাল লাইফ?
That is very important. The reason for doing the surgery is bringing back to their normal life. Okay, so the surgery within in a month time they can do all their work back to normal. Okay, so many people they cannot go for office, they cannot go for a bank or all the work. Within a month we can make them better, and they'll do all their work as normal as everyone else.
And Dr. Vijay Shankar, what are your message to patients or peoples?
The important thing is, don't worry about Parkinson's disease. Parkinson's disease is a simple disease like any other disease. The progression, even though it's going to be a progressive disease, the progression is in your hands. If you do regular exercise, if you take a healthy diet, yoga, meditation, important thing is keeping yourself happy is going to slow down the disease progression. And if the disease is progressing to the next stage, we are here to help you with the deep brain stimulation. We can give you a good quality of life for you and your family members. Thank you.
Exactly. Thank you, Dr. Vijay Shankar, for joining with us. অবশ্যই আমাদের এই আজকের আলোচনা তো এখানেই শেষ, এবং এর মাধ্যমে কিন্তু আপনারা বুঝতেই পারছেন যে পার্কিনসন্স ডিজিজের যখন আপনারা যে যে সিমটমসের মধ্য দিয়ে যাবেন তখনই কিন্তু আপনাদের চিকিৎসকের সঙ্গে পরামর্শ নেওয়া আবশ্যক। অবশ্যই আমাদের আজকের এই ডাক্তার বলছেন অনুষ্ঠান এখানেই শেষ। দেখতে থাকুন কলকাতা টিভি, রাত দিন 7 দিন।